Let me call upon Dr. Sandhya N to talk on the platter to choose from. Over to Dr. Sandhya.
Thank you, Dr. Soni, for the opportunity. Now, multifocal intraocular lenses, the platter to choose from. Now, when we are young, we can see at all distances because of accommodation. And but after pseudophakia, there is total loss of accommodation. So how can we give multifocality to our patients, pseudophakic patients? We have three options: monovision, multifocal IOLs, and accommodative IOLs. I'll be dealing with multifocal intraocular lenses. So these lenses, they give two or more focal points. So mainly they are of two types, refractive and diffractive. In diffractive, we have bifocals, trifocals, and extended depth of focus intraocular lenses. So refractive lenses, they have multiple rings on the optic, and each of these rings will focus light at a particular focal point. So these lenses were pupil and centration dependent, and the photic phenomenon was high, so they didn't gain popularity. Now coming to the diffractive lenses, they have multiple diffractive steps on the optic, and each of these steps from the periphery to the center focus light at two different focal points, that is one for distance and one for near. And these steps, according to the width of the step, that determine the adhesion. Narrower the step, the higher the adhesion, and when the height of the step was more light entered the eye. So these lenses, they had less halos and glare, but the intermediate vision was not great with these lenses. Now then came the concept of apodization, where there was gradual tapering of refractive steps from the center to the edge of the optic to give a smooth transition of light from distance to intermediate to near. Now the traditional multifocal lenses were bifocal lenses. They had two focal points, one for far and one for near at around 30 to 40 centimeters. They gave excellent distant vision and near vision, but compromised intermediate vision. So these lenses, they've divided the light, they split the light, that is 40% for distance and 40% for near, and the remaining 18 to 20% of the lights were dispersed, that is scattered or lost, and this produced the glare. And since they had two focal points, at each of these points, they had a second superimposed image from the first one. So there was halos around the light, and this was their disadvantage. Now these were the commonly used available bifocal lenses. Now most of them are becoming out of practice now. Now coming to the newer generation multifocal IOLs, first we have extended depth of focus lenses. Okay, these lenses, they created an elongated continuous range of focus to enhance the depth of focus, contrary to monofocal lenses which had a single sharp focal point and bifocals which had two focal points. Now the pure EDOF lenses, they employed either the spherical aberration based optics or the pinhole effect. And then we had hybrid EDOF lenses which employed the chromatic aberration, or they had a diffractive hybrid profile. Now these lenses, they gave good distant and intermediate vision, but the near vision was not great. And since they didn't have separate focal points, they had less photic phenomena, but the trade-off was because of the less light, the contrast sensitivity was poor. Now this is a lens that uses increased spherical aberration. That is, you can see as the spherical aberration range increases, the depth of focus also increases. Now another type of EDOF lens is that using pinhole effect. It uses an opaque pinhole to mask in a monofocal IOL that will increase the depth of focus because it will cut off the unwanted paraxial light. So one such lens was IC8. Now coming to yet another lens, that is Technis Symphony, which was a hybrid EDOF lens. It used the Edge-Light technology. That means there was modification of the height, spacing, and the profile of these diffractive steps, so which provided the extended range of focus. And these were the toric lenses were also available, correcting 0.6 to 4 diopters of astigmatism. Now another lens was supraphobe in focus by Appasamy. It was basically a bifocal refractive lens with an EDOF profile. Now coming to another one, that is VVT. It is a smooth surface transition element which stretches and shifts the wavefront to create an EDOF effect. Now these were the commonly available EDOF lenses, and we have the lenses from Indian companies like Supraphobe in focus and Magnificent by the Care Group. And another lens, that is Technis Eyehance lens. I would call it a Superman monofocal lenses because this is basically a monofocal lens, but it gives intermediate vision up to the range of 66 centimeters. This this extended depth is given by a smooth continuous progression of its power from the periphery to the center with no demarcation line. And the advantage of this lens was the photic phenomena that was less, and this could be implanted. Since it is a monofocal lens, it could be implanted in patients who are not ideal candidates for multifocal because of either some macular lesions or other ocular pathologies. So such people, we could offer these lenses, at least they could have some intermediate vision. Now next in the spectrum is trifocal lenses. They had 3 distinct focal points, one for distance, intermediate, and then for near. And they had improved visual quality because the light transmittance was good, but the photic phenomena was comparatively less with these lenses. Now these are the commonly available trifocal lenses. That is the fine vision, AT-LISA, PanOptix, and Tridiff. Of these, most of these lenses, they gave near vision in the range of 39 to 42 centimeters. The intermediate vision of most of these lenses were 80 centimeters, but for PanOptix it was 60. So they had high light transmittance of about 86 to 88%. So the distant vision was not much compromised. Now the last in the spectrum is the continuous range of vision lenses. See, if you can see this here with my bifocal lenses, it had a distant focus and a near focus, but there was a gap in the center. Then with trifocal lenses, the distance, intermediate, and the near vision was good, but the junctions, there was a gap. So in these junctions, what they employed was they employed the EDOF technology to give a continuous range. So one of such lenses is Synergy, and they have toric platform also with that. So in summary, the traditional multifocals were bifocals. They gave good distant and near vision, and the intermediate vision was poor, but they had high photic phenomena, so they are slowly becoming out of practice. And the next is the EDOF lenses. For them, the distant vision and the intermediate vision was good, and the photic phenomena was comparatively less because they didn't have distinct focal points, but the trade-off was decreased contact sensitivity. And the trifocal lenses, they have comparatively less photic phenomena and have a reasonably good distant, intermediate, and near vision. So we have to select from these platter for the better outcome of our patients. Thank you.
Thank you, Dr. Sandhya, for that explanation of the various kinds of multifocal and EDOF lenses which are available.